Hello everyone, and welcome to another Wellness Wednesday. I'm Dr. Whitney, Dr. Mom ND, and sorry, I'm just trying to get my ring light right. I think I should have closed my blind because half my face looks like light and half is dark because my window's over there. I think that's good though. Okay, so today what I wanted to talk about was vitalism, which is an interesting topic because I have to admit I have been getting more and more frustrated with some practitioners, some NDs, but even people who think they're addressing the root cause and they're not, and just using supplements, what we call green allopathy. So allopathic medicine is what we know as conventional Western medicine because it's symptom based. So they're always treating symptoms, or rather suppressing symptoms, because to them, the definition of health is you not having symptoms. But in naturopathic medicine, what we understand is that symptoms are an alarm system. They're your body's way of telling you that something is wrong, something is not functioning right, something is out of balance. Usually that encompasses a elimination of sorts and an elimination of sorts, as I've showed you before, that chart that had the arrows that go both ways, down and up, right? So as something compromises the body, there is some kind of response, some kind of symptom, usually as a means of elimination, and then a return to health, right? And a return to health, and that's homeostasis, and that's what our body is always trying to do. And so if you suppress that reaction, that response, the body isn't actually returning to health. You're just suppressing it, and it drives it deeper and deeper and deeper and deeper. And soon you get these layers. And so to ever truly return to health, you have to work back through all those layers. Now, a lot of natural practitioners, even some naturopathic physicians, have fallen into the trap of simply using supplements. And that is really not what the foundation of naturopathic medicine is. As I've shown you on the therapeutic order, that triangle food pyramid looking thing, the order of healing and intervention that occurs, the supplements are not until like the 4th or 5th level, okay? So they're not fixing the problem. Your problem isn't that you have a, let's say, magnesium deficiency. The problem is what is causing the magnesium deficiency, right? Because if you're eating a healthy, balanced diet, if your gut is healthy, then you should be absorbing and utilizing all the magnesium you need, right? You shouldn't need to be taking 3 different forms of supplemental magnesium. Side note, that I got that anecdote because of a patient who came in to see me who had gone to a supplement store and was told by the owner that she needed to take all these different supplements and 3 different forms of magnesium, and she couldn't figure out why, when she spent all this money on supplements, had taken active steps to do things that were naturally, supposed to help her be healthy, why she started to feel worse. Well, when I did her food intolerance, we found out she was actually, her primary intolerance was fruit. Well, guess what? Every single one of those supplements had in it fruit. So she went from not really eating a lot of fruit in her diet and not taking any supplements to focusing on this whole regimen that was fruit laden. As soon as she stopped taking all those supplements, cleaned out the other miscellaneous fruit, she felt better, okay? So when you use supplements to address symptoms or deficiencies or whatever process or method some kind of practitioner out there is using to tell you that, oh, you need to take vitamin C, if it's muscle testing, if it's some kind of acupressure point related muscle testing, some kind of applied kinesiology, some kind of lab, they're not addressing the root cause. They think they are because that's what they've been told, right? Because selling you a supplement fixes the problem. Well, it fixes the problem the same way taking drugs fixes the problem. It doesn't fix the problem. It covers up the problem. It doesn't really address the root cause. So that we call green allopathy. Okay, so allopathic medicine is conventional Western medicine as we know it today that treats symptoms. It's 100% symptom based. If you have high blood pressure and they give you a high blood pressure medication and now your blood pressure is better, they have fixed you. They've done their job in their mind. But what happens when you stop taking the blood pressure medication? if you haven't changed anything about your diet, your lifestyle, your food intolerances, the blood pressure goes back up, right? So did the pill fix it? It didn't fix it. It's managing it. It's suppressing it. It's preventing your body from expressing that symptom that it needs help. Likely that there's inflammation in your cardiovascular system. So the point is, you can take pills to suppress symptoms, but you can also take supplements to suppress symptoms, okay? So there's this niche that is really growing within the naturopathic community called Vitalism, because using your vital force, that natural healing force in your body that is always trying to do that homeostatic juggling act of returning your body to health, that is what the focus should be, right? Supporting that. So it's this article was in the Naturopathic Doctor News and Review publication that I get. It's part of a discussion that happened between Dr. Sensig, who passed away last year. I'm sad that I never got to meet him, and Dr. Letitia Dick. And why does it say VNMI? I know I'm forgetting. It's the Vitalism Naturopathic Medicine Institute. Is that it? Anyhow, so these are some older practitioners, experienced practitioners that have taken it upon themselves to re-educate the next generation, to reiterate the importance of the philosophy and working with the healing forces of the body and not relying on, you know, even naturopathic doctors. That's what's happening, is they're getting sucked into the modern stuff, right? The food sensitivity testing, the nutrient panels, the MTHFR, all the genetic stuff, and supplements and you know, what do you say, custom supplement recommendations and testing and stuff. And that isn't what naturopathic medicine truly is. That is what we call green allopathy, or like greenwashing, when they try to make a natural product, or try to make a product that seems natural by putting all kinds of natural, you know, plants on it and saying it's botanical based, but it still is full of parabens and phthalates and fragrance and all kinds of crap, right? Calling something natural or greenwashing it doesn't make it more natural and chemically free and safe. So it's the same thing with supplements. If you're just simply giving someone supplements the same way a doctor would give, a medical doctor would give someone drugs, then you're practicing symptom-based management. You're just doing allopathic medicine, but in a green way, right? So I want to see where it says, yeah, so Dr. Letitia is a founder and senior vitalist of the Naturopathic Medicine Institute. So this is an institute, a group of practitioners who are refocusing on the vitalist or the vitalism aspects of healing. So, and Dr. Sensing had practiced for over 40 years. Sadly, he passed away last year. So I read this article, and I thought, after last week's discussion about reiterating about the food intolerance and foundational pillars of health and addressing those things, that this was just a really interesting conversation. So I'm just going to basically be reading this today to share it with you. So the title of the article, or the excerpt, is called Vitalism is the Standard of Care. And this was basically just a discussion between Dr. Sensing and Dr. Letitia Dick. So this article joins a series of articles in NDNR that are based on transcripts of the Naturopathic Medicine Institute's Wednesday morning call-in program, The Vital Conversation. The program is hosted by senior vitalists to enhance the ability of naturopathic physicians to practice as vitalist naturopathic doctors. In this lightly edited transcript, the first part of a two-part conversation that took place in April of 2017, Dr. Sensig and Dick discuss why there is such an apparent, widespread resistance to the obvious potency of the vital force, what we naturopathic physicians with love and respect call the VIS. So Dr. Sensing says, a conversation about the vital force will never get old. I suggested a thought experiment to a patient the other day. If you get a superficial cut or wound, you could then watch the body do this miraculous thing of repairing the tear and the cut all by itself, without any instruction or even much intervention from you. And in a few days or a few weeks, depending on the situation, it's nearly impossible to tell that anything bad had ever happened. So if it's true that when you cut yourself, isn't it also true that when you are diagnosed with diabetes or rheumatoid arthritis or MS, what's the difference? Why would conventionally trained physicians think the body is suddenly so stupid that it doesn't know what it's doing? Why is the allopathic doctor's job to manage those symptoms rather than to help encourage the conditions that are necessary for that miraculous event we call healing to occur? Another example of this kind of backwards thinking is around breastfeeding. I recently heard about an article that proposed that breastfeeding is actually not natural and that anybody who breastfeeds is probably also an anti-vaxxer. Dr. Dick responds, that was actually just posted on Facebook 2 hours ago on our Vital Conversation link. It's quite shocking. It's from the American Academy of Pediatrics. Now, mind you, this is from 3 years ago, so maybe the stance has changed, but this was current at the time of their discussion. This is telling health professionals to stop prescribing breastfeeding as natural. The author writes, it can lead parents down the path of alternative medicine, homeschooling, and becoming anti-vaccination. Dr. Sensing said, that is so crazy. I had a new patient, a young child, almost a year old, who was brought to me by his single mother after having trouble feeding him. Every time he was fed, he would throw up. This started out with breast milk. Then the mother's pediatrician urged her to try a cow's milk formula. Several variations of bovine milk were tried, and the child had no improvement whatsoever. After a history and exam and some testing, I recommended a goat's milk formula. Problem solved. I used some remedies and I did some other intervention. After this problem was solved with the change in formula, she went back to her pediatrician. Of course, the pediatrician wanted to know how the child was doing. She said the problem was solved. He was feeding well and keeping his food down, his appetite had increased, and he was putting on weight and catching up to where he should be on the growth chart. When pressed for more details, the mother told the pediatrician she had seen a naturopathic doctor in Connecticut who put the child on goat's milk. The pediatrician not only freaked out about the goat's milk, she reported the mother to the state's Children and Family Division for child abuse. Suddenly, I had an out-of-state investigation on my hands. A case manager, a caseworker, and another investigator inquired about my treatment for this child. When I explained the situation, they just said, "That's what I thought," and they waved it off, clearly not concerned. But I was told by the investigator that the pediatric community in the United States is being told that goat's milk constitutes negligence or abuse. And Dr. Dick said, where can that possibly come from? I can't believe that you would be considered child abuse when you're giving your child a nutritional substance that actually stays down. Dr. Sensing responded, I think where it might come from is this. As anyone who is listening to us knows, or they should know, goat's milk is not in and of itself substantial enough to be a breast milk substitute. It has to be fortified. Once fortified, you have a very good baby food. So maybe it's because straight goat's milk by itself is inadequate. But any physician prescribing goat's milk ought to know how to make the needed changes to bring it up to nutritional requirements. Somebody just texted me while we were talking and asked, what about a Happy Meal? Is that child abuse? And Dr. Dick said, well, actually, I consider it is, yes. I actually had a conversation with a grandmother recently. She brought in her grandkids to assess their food intolerances and get them on a healthy diet. She looked at me and said, well, as a treat, I take my grandkids to McDonald's. You mean I can't do that anymore? And I said, no, I'm not saying you can't do that. It's just that you're going to have issues trying to find the right foods for them there. If it's the playground part that you're looking for, why don't you pack a healthy picnic lunch instead and take them to the park? They can play on some playground equipment and have just as much fun. I guess she hadn't even thought of that. People get ingrained in these bad patterns. Dr. Sensing said, I read just recently that the average child in America, I forget what the age range it was, but they spend about 5 hours a day on some electronic device with a screen, 5 hours a day, but only 1 hour a week outdoors. So I'm not surprised that Grandma didn't think about going to the park, because what child goes to the park anymore? Before we get into more cases, I'd like to mention that a colleague of ours talked to me the other day about a new patient. This patient had also seen another naturopathic doctor in the same city and mentioned that she would not be going back to that first naturopathic doctor because that doctor had attempted to coerce her into taking statins. If you don't know what statins are, they are the drug for high cholesterol. If naturopathic doctors are prescribing statins, SSRIs, which are antidepressive medications, prednisone, a steroid, vaccinations, and antibiotics, and how is that different from conventional medicine? How do these doctors explain what they're doing? What makes them naturopathic when they're doing allopathic medicine? Dr. Dick said, somehow our newer graduates have been led to understand that from the allopathic perspective, these pharmaceuticals are actually considered to be preventative. So they feel in their hearts that they're doing the right thing because it's preventative care. If you can lower someone's cholesterol, hopefully you're preventing a cardiovascular event in the future. Whereas you and I know there's no relationship between high cholesterol and cardiovascular events. Unfortunately, the young naturopathic doctors are falling into the medical model group think. They assume that's preventive care, just like they assume mammograms are preventive care and other preventive allopathic mandates. In the allopathic model, this thinking makes sense, but that's not how naturopaths think. Dr. Sensing said, this is a good place to repeat a point made by my guest, Razzie Berry, the founder of NDNR. NDNR is going to provide some scholarships to the NMI meeting next month. Through her social media, et cetera, they're over in touch with 180,000 people. They're hoping to reiterate this thinking among naturopathic doctors. People don't want more allopathic doctors. The last thing this country needs is more allopathic doctors. She was also careful to add that they not only don't want allopathic doctors, they also don't want integrative doctors or functional medicine doctors. Her audience is making it loud and clear that they want naturopathic doctors, doctors who understand the basic philosophical practice-driven thinking that is vitalism. I cannot understand why anybody would want to go to naturopathic medical school to learn allopathic medicine. Why this is happening is multifactorial, but this is what's happening. If someone wants to go do allopathic medicine, why not go to allopathic medical school? Substituting natural stuff for prescription medications is not naturopathy. It's so-called green allopathy, which is what we were talking about. So let's keep talking about how to think like a naturopath with some case reviews. So Dr. Dick says, 2 weekends ago, I taught an advanced hydrotherapy course in Spokane where I have my practice. I had 10 wonderful students. Then this past weekend, I taught the Carroll food intolerance method with Dr. Jared Zeff. That's what I went to. We had 9 doctors taking that course. And as these young doctors are in my clinic, I'm listening to what they know and what they don't know. I asked them what they were looking for in education and how I could bring it forward to them. Some of their responses astounded me. I hadn't realized some of the gaps in their knowledge or their support base. That's the platform for discussing these 2 basic cases now. I had a patient who is middle-aged, a woman with many problems, including some debilitating anxiety. She was running to her medical doctor and then running to me and back to her medical doctor and back to me. It's been quite the journey with her. She came in after taking a proton pump inhibitor. For those of you who don't know, proton pump inhibitors are the acid reflux medicines that suppress your body from making acid for digestion, which is a bad idea. Anyways, she had been taking these drugs for several months for severe gastritis, so inflammation in her stomach. The gastritis was caused by other medications. She was taking these meds, really suppressing her stomach function and feeling more and more terrible. I said, listen, you've got to come in for a visit. I need to look at your blood under the microscope before I can tell you what's going on. So we did an intake. I did an acoustic cardiograph on her. I looked at her blood under the microscope and it was pale, almost white. She was so anemic. I said, wait, the only thing that really changed between the last time I saw you and this time was starting these proton pump inhibitors. She said, yeah. That's what I'm doing because the gastritis is so bad. I said, well, look at your blood. Look at what happened. You're not absorbing anything because of those drugs. You can't suppress your stomach acid and expect to have good nutrition go into your bloodstream, which is what needs to happen to be healthy. You just can't do that. I simply switched her from the PPI drugs to capsules of bitters containing just 2 simple ingredients, gentian and skullcap. Dr. Sensing said, here's a question that comes up often. Did she have any difficulty symptomatically in making that switch over? Did she stop the PPI cold turkey? And Dr. Dick responded, yes, she stopped it cold turkey and then switched to the bitters. I did not have to wean her off the PPI. Some people want to do that, And that's fine, but I like it when they just stop it and start the bitters. It works better that way. She started feeling better immediately. She didn't have the GERD and reflux. We worked on other things with her. She's an emotional wreck, and that's part of her digestive issues. The stress loads she put on herself is intense. We had to work through that as well. In 2 months' time, I looked at her blood again. Totally different. It was red again. I showed her the difference between taking that suppressant stomach acid drug and now taking supportive therapy that actually stimulates digestion and tonifies the stomach. What a difference that makes. She was shocked. This is a person who is medically oriented, and it was an awakening point for her to realize that those drugs were actually hurting her. Now we're in the process of weaning her off other meds, and I'm working with her in these other areas. It's a journey, and sometimes the light bulb doesn't initially go on with people. Dr. Sensig says, from a philosophical point of view, this is actually Lindlar 101. So Lindlar is one of the founders of naturopathy. We all learn about him as like a founding father. Buildup of the blood with good nutrition and herbal therapies. In this case, you wanted to let the digestive system absorb the nutrients she was consuming, which is the way it's supposed to work in order to bring the blood back to its optimal state. And that, of course, is going to have an impact on everything else and the other symptoms she was complaining about. Is it really possible that medical doctors, especially gastroenterologists, don't understand the basic physiology of digestion? Do they not understand that the hydrochloric acid has a genuine beneficial purpose? This actually brings me to another point. The conventional system of medicine would like everyone to believe that what they're doing is scientific. You hear that word thrown around a little bit lately? Whatever they mean by that. And that everybody else is non-scientific and practicing quackery. But think about it. Our underlying philosophy is the science. Because what we're looking at here is that the basic physiology of digestion needs to be supported and not interrupted or not suppressed, right? So stopping the natural process is what passes for real medicine in our culture, where we're handing out these PPIs like candy because they are something that can be marketed. I'm sure you've seen this as well. I've seen children, even infants, on PPIs. And I personally can attest to this because before I ever went to naturopathic medical school, I was working at UW Hospital in the department for, oh gosh, what was the name of it now? It had such a long name, but basically it was the department that partnered with Unity Health Insurance to work on insurance claims. And I can't tell you how many prior authorization requests I had to help the pharmacist process on behalf of infants that were being put from breastfeeding onto a bottle and then having PPI drugs put in their bottle. Oh my gosh. Dr. Dick says, that should be illegal. That should be criminal. Yes, it should. You should never do that to babies. Dr. Sensing says, the only reason it's not criminal is because in the conventional system, they all get together and agree that that's the standard of care, even though it flies in the face of basic physiology. The legal point being the medical profession operates in a vacuum where it is not responsible to, overseen by, or accountable to anybody except each other. They have convinced themselves and regulators and everybody else that nobody can hold them accountable because nobody knows what it is that they're doing. So they have their own little secret cult where they decide together what's going to pass for treatment, and nobody can criticize it because nobody could possibly be at the same level of understanding or stature in our culture. In this way, they get away with what would be absolutely criminal interventions in any other profession or walk of life. Also, think about the patient you just described, an otherwise intelligent person who doesn't realize that medicines are harmful. Dr. Dick says, yes, she's really integrated into the medical world, yet she comes to me because she wants nutrition and natural care. She really doesn't fully understand the tilt of what natural care means. I think a lot of people are walking through life like that. They think, well, I can take some herbs, but I'll also take these drugs. That doesn't fly in my world. My goal is to get people off the medications as gracefully and quickly as possible. That is also hopefully my goal someday. She continues, for some patients though, their vital force is simply too weak. They don't have the vitality to switch cold turkey to natural health care. So what I end up doing is managing them on their drugs, which I absolutely hate doing, and supporting them as best I can to move them towards a level of wellness where they can wean off the drugs. Maybe I can't get them up to optimum health. Maybe I can just barely get them into survival mode. At least they're better off there than where they were, sliding down the slippery slope of more and more medications. Dr. Sensing says, this brings us to a concept that this patient simply wasn't understanding, as most people don't. That allopathic medicine and naturopathic medicine, or in other words, the mechanistic and the vitalistic approaches, are working at cross purposes. They are not the same. They are not even in the same ballpark. The difference is simply that in allopathic, conventional, mechanistic medicine, the therapeutic rationale is to suppress the symptoms, period. If you have inflammation, they use anti-inflammatory drugs. If you're vomiting, they use an antiemetic. It's all antibiotic, antiphlogistic, antifebrile, anti. The drug works against the symptom. It suppresses the symptom on the assumption that the symptom is the problem. Whenever you use a medicine allopathically, you are going to create a new set of symptoms by definition, since the underlying problem has not been addressed. Whereas what naturopathic doctor's doing, and what the patient you just described doesn't clearly understand yet, is trying to work with that constructive principle, that evolutionary force, that healing intelligence, which we call the vital force. True naturopathic doctors are working with the force, not against it, by suppressing the symptoms. Again, naturopathic and allopathic interventions are at cross purposes. If you're a Star Wars fan, you probably liked that last little bit, right? We work with the force. And Dr. Dick says, you're right. You can't do both. And Dr. Sensing follows up by saying, what the patient is assuming, and unfortunately what many people in today's naturopathy are assuming, is that simply substituting a natural substance for whatever other drug they're taking means that they're getting good naturopathic care, or rather good natural care. Dr. Dick says, yes, but that's not the whole story either. I can relate to what you said about the gastroenterologist scenario. I had a patient a number of years ago with irritable bowel and Crohn's disease. Her grandmother sent her up from Florida because they were scheduling her for a colostomy and a resection of most of her colon. She was only 18 years old. I determined through the Carroll method that she had a fruit intolerance. In Florida, of course, she was eating fruit all the time. I simply gave her 10 hydrotherapy treatments and bitters to go home with. The bloody diarrhea stopped in 3 days. She basically healed her colon by changing her diet. She actually took her blood photos back to her gastroenterologist, who was really mad because she canceled her surgical appointment. She said, listen, doc, I'm doing great. I have no more bleeding in my colon after 3 years, and I'm not messing with this. It's really because I was eating the wrong food. The doctor said that diet had nothing to do with her problem and kicked her out of the clinic. He said he never wanted to see her again. She called me up in shock. She said, well, this is the doctor who specializes in the gut, and he's saying the diet has nothing to do with my problem, and yet I know it does. What is that all about? And I told her that allopathic doctors are ignorant of the vital force and think their medicine is the only true medicine, which makes them arrogant. She just couldn't believe it. Here's this 18-year-old girl trying to show her doctor that she's okay now because she changed her diet. It's that simple. Dr. Sensing said, it's amazing that a medical doctor doesn't understand that what you put in your body actually affects it. That's what we're talking about. But it's more criminal that the people who hold themselves out as experts in the digestive system don't know that or don't want to think about it. It's one thing if someone like a neurologist or an orthopedist doesn't know much about the diet, even though they should. But a gastroenterologist should know that food affects the gut. You'd think that kind of miraculous improvement we see under the right conditions, when reported to a medical doctor, would make that doctor curious about what helped their patient. They're confronted with that kind of information, and not only do they not inquire about what happened and get more details, but they get angry and they respond with bluster and ego because it challenges their whole belief system. Either they have got to reject it or embrace it. Embracing it means reevaluating their beliefs, and that's a big step for a lot of people. That's a big step for a lot of people, period, in this day and age, right? Given the political climate, the COVID stuff, reevaluating your own beliefs, big step. Not just pointing the finger at someone else and saying, you're wrong, only I can be right. Only I can have the right information. Dr. Dick says, this is because they have invested so much time and money in the allopathic camp. And Dr. Sensing said, I actually had an associate here some years ago who had a pre-planned response to those patients who quote their doctor as saying that what's wrong with them has nothing to do with their diet. This associate of mine would put down her pen, she would take off her glasses, lay them on the desk, sit back in her chair, fold her arms across her chest, and she would say something like, let me get this straight. Your doctor is telling you that what you put into your body does not have any effect on your health at all. Am I understanding that correctly? And invariably, the patient would say, well, now that you say it that way, it kind of is stupid, isn't it? And Dr. Dick says, yes, it is pretty astounding. And that's how they end it. So that gives you several examples of how different the approach can be, how people may be saying one thing that they're helping you with your symptoms or they're addressing the root cause when in reality they are not, okay? And people's ego very often gets in the way. I give a lot of practitioners credit because I do think, hopefully, genuinely, everybody does want to help. But if you can't be open to new ideas, if you can't be open to other possibilities simply because it wasn't in your wheelhouse at that moment, then you're the problem. So that's all for today. Thank you for joining me. And I will see you all next week for another Wellness Wednesday. I've actually got the topic already picked out. I've decided kind of continuing with this theme of vital force and energy and good energy and healing. I've got some things about chakras and energy channels in the body, and continuing with that good energy for the mental, emotional health and well-being of people right now by balancing those energy fields and things like that. So I think that'll be a fun and interesting topic for people. If you've never dove into chakras and energy healing and all that kind of stuff, I think it'll be interesting because before I lose you, what it ties into actually is acupuncture. So, and even further back ties into the whole EMF frequency thing, because acupuncture actually, the process of it is opening the energy channels, the meridians in the body so that your qi can flow. That's what Chinese medicine has been based on for thousands of years, and it works really well. I love acupuncture and recommend it to anyone for really any condition. So I'm going to tie all that together in a fun way next week, and I hope that you will all join me then. So until then, have a great week. And this is Dr. Whitney from Holistic Home Health and Wellness saying take care, and I'll see you next week. Bye-bye.